how do you manage some of these things without kind of driving yourself crazy, right? Because you could
Yes,
really go nuts trying to clean everything and watch yourself, and even then, how much can anybody possibly do?
exactly. Well, you might go a little nuts. You might. There are a lot of things to do, but I have to tell you, I went a little nuts not knowing those things, and my dad died,
Right,
and my husband nearly died. And I have to tell you, it's very, very difficult to live with, well, what if I had only known?
right.
I sat for hours with my dad watching TV, the Golf Channel actually, which is his favorite, and
Um,
CNN. And I could have been wiping down bed rails. I could have been wiping his IV pole and making sure that he had the pulsating boots to help prevent the blood clots. There are
right,
a lot of things I could have done. So I am a little nutty now
yeah,
about these things, and
right,
it's just tough to live with.
right. I'm so sorry about that.
Well, we're there. We're here to make make
You
it
are.
better.
You're going to help
Yeah,
so many people. Um, and do you want to talk at all about your husband? He got sepsis.
sepsis. Yes, and that was a case of where he did speak up. He told the nurses that he felt his stomach was growing distended and harder, and he was in incredible pain. And they kept saying, oh, this happens after surgery, but he literally was trusting his gut that something was wrong. He had surgery on his intestines, and what had happened was that the sutures did not hold.
Oh my gosh.
All of the fecal matter that was in his intestines was literally pouring into his stomach and his
Oh
bloodstream.
my gosh.
And
And I know that that can be fatal for sure.
yeah, it can be fatal. And what we didn't know at the time is that when you speak up and you feel like no one is really listening, you do have the power, you have the right to call for a condition help, also known as a rapid response team.
Okay.
It means you can start with a new nursing supervisor to be sure,
Right.
or you can go up to the patient advocates. But if you don't feel like you have time and you feel like you're in a situation where your loved one is in peril, you can call for a rapid response team.
Okay, that's good
All
to
you
know.
do,
Thank you.
dial 0 on the phone and say, how do I get a rapid response team up here?
Okay, that's good to remember. Thank you. Is there anything that patient advocates should be sure not to ask? Are there any red lines not to cross?
That's a really good question. The What I've read is that it really bugs doctors and nurses when people come in with their reams of paper from Dr. Internet. There's a lot of bad stuff out there. There's a lot of misinformation out there. So what I would really recommend is, and it's a good thing to do your internet research, but make
Right.
sure that you're going to government agencies, associations like National Stroke Association, American Cancer Society,
Okay.
really prominent, well regarded. Download all of your information, take your highlighter, and organize the information and organize your questions. But I would recommend that you don't go in there and says, well, Dr. Google tells me this.
Right.
It's very
No,
important.
no offense to the Google Hangout.
No, no, no. But honestly, it's I have heard that they just kind of roll their eyes
Okay.
because people have brought in kind of wacky stuff.
Okay. So basically, you want to go to the trusted, uh, respected organizations and use those for your information, and then I guess sort of be
Right,
judicious about which questions you ask from those
right.
resources.
But
Okay.
that's not to say that you shouldn't go, if you are a big believer in integrated medicine and you feel that diet and exercise plays a part in recovery, um, it's okay to bring that in too, but just
Yeah.
make sure that your sources are solid.
Right. Although diet and exercise have been, now by all the most prestigious medical organizations have been considered more integral than they ever realized before for managing
Right.
care. So even there, the integrative is becoming much more mainstream. Um, last question. We talk a lot about how patient advocates obviously the book is for patient advocates. Any advice for the professionals in the healthcare industry? Because I know you talk a lot about this being a team effort, that there's simply so much to do to take care of patients that it's not really even fair to expect that the nurses and the aides and the doctors can cover everything. And so you talk a lot about the care partner, as you call it,
Yes.
taking on a partnership role with
Right.
with the healthcare workers. Any advice for the healthcare workers on their side of that partnership?
Well, I'd have to say that this notion that families can be effective care partners and should be considered care partners is, we're at the tip of the iceberg. There, and I don't know if that's apt, we will get to the point where that is more the norm than the exception.
Okay.
And really, a lot of that is driven by Medicare's Partnership for Patients. They have four main goals, near-term goals, and the fourth goal on their list is patient and family engagement. So everything about healthcare is now being driven by Medicare because they establish all the payment practices. So there are going to be some pretty good incentives for reaching out and including patients and families in all care decisions.
And that really is, of course, a sea change over the last several decades, because it was always, the consumers become more empowered through the internet and the democratization of information, basically access. So
Exactly.
that's a great thing, and it's now, as you point out, a necessary thing. So, Karen, we appreciate so much that you've taken some of your trials here, very hard-won lessons that you've learned, and created this book so that we can, all of us who know and love people that will inevitably be in hospitals, that we can help protect them and safeguard them. We thank you very much.
Well, that's my hope, and thank you so much for helping to spread the word. I really appreciate it, Rachel.
Okay, thank you. That was Karen Curtis and her book, Safe and Sound in the Hospital, and I'm Rachel Pomerantz, Health and Wellness Editor for U.S. News and War Report. Thanks for joining us.